Hello, good evening, everyone, and thank you all of you for giving excellent response for the videos, and especially the videos which are addressing to queries, questions that our youngsters are having, and thank you for your kind feedbacks that you are giving, and that is so inspiring for us for making more of such content. So today's topic is about acutes. So when we say acute, many of the youngsters, they feel that they have this dilemma that do we really have to get into it, and uh, are we able to deal with it, and if not, then what would be the probable repercussions of it. So I have made a note of few points which I'll be discussing with you all, and I have divided this video into three aspects. First is why we should take the acutes. The second aspect of this video is how to handle acute, especially how we handle it in the clinic. And the third important thing is once you are tackling the acutes, what benefits they are going to give it to you in your practice. Okay, and at the end of the video I would like to give you one very important tip, because that has found really miraculous in some kind of cases. I'll come to it later on at the end of the video. So let's start about this video. All kind of fever cases, then seasonal cough and cold, then sudden attacks of migraine, no previous history, sudden attack of stomach aches, then something that is happening very sudden, and with some cause to it, and there is no previous history to it, recurrent history to it, and patient is like in a panic mode because they have not undergone such situation, or they do not want to go to modern medicine and they want to rely on homeopathy, and they come to you for rescue. So all such conditions which give us short time span, and of course for the patient also it is they have come across such thing in a very recent past or maybe today. So these are the things which we are talking about when we are discussing about the acutes. So first thing is why we should handle acutes. The first point is, as we always say, as a homeopath, we have to sharpen our skills, sharpen our senses, especially because all our prescription lies on what peculiar thing we see in a particular case, and for that our senses, our eyes, our ears should be very sharp to quickly grasp what is that thing which is diseased or which is not at ease, and because of which the person is disturbed. So these acutes, my dear friends, they give us the constant riyaz, they give us the constant sharpening to our special senses. Say for example, you have to appear for an examination 6 months later, okay, which is very important for you. So what you do generally is you study well, and then you try to solve case papers on that particular examination. Why? Because you are doing riyaz, you are doing practice for something bigger that is coming your way. Similarly, for example, if you are an artist and if you have some performance of yours, say for example, few months later, few weeks later, so what you do is daily you do riyaz of your voice, of your steps. So these acutes are actually our riyaz for making our special senses acute, clear, very perceptible for the chronic cases. Are you getting what I'm trying to tell? If you directly sit for a chronic case without handling any such small steps, it would be difficult for you to even concentrate for that 45 minutes or 1 hour or 2 hour, whatever you are spending for the chronic case, because your tools, and especially in the case of homeopaths, the tools that are your eyes, your ears, your the senses, which gives you the indication, yes, this is peculiar, yes, this is characteristic, is not sharpened time to time, because you have not come across a situation where they will be used, where they will be sharpened. So the first and the foremost important thing why you should take acutes, why should you should handle the acutes, is they are the things, they are the short courses, you can say, to sharpen your senses, and that is very important. The second point is, acutes actually help you to regularly go through materia medica, regularly go through the rubrics. Imagine a patient is coming to you with, say, for example, say fever. He is having high degree fever, and what he is telling is, doctor, since the time I have developed this fever, my appetite has suddenly increased so much that, I'm just eating and eating and eating. There is no satiety. And my hunger is never in such a drastic manner. And can you imagine that when person tells us this thing, and when you open the book and then it is given, okay, see, the rubric is there, appetite increase, hunger increase, fever during, you will never forget it in your lifetime. Because now it is not just a simple, you are turning the pages and reading it. You have the live example in front of you. Now the second point is how to tackle acutes. So in this section, I would like to tell how we handle acutes. So the first important thing is, which is, we follow otherwise also, that is to listen to what is characteristic. And especially in the case of acutes, this point becomes very important, because you have a short story from the patient. Acute means you would not have the long story, and then you have to see whether this point is repeating, and if it is repeating, then only it is important. It is not so, because it's an acute condition. Maybe 6 hours before, the patient is suffering from the headache or the gastric disturbance or the fever or any such kind of acute condition. So you have short time, short history, and in that you have to understand what is disease specific, I mean, what is common to that disease, and what is characteristic. Now let me give you one example to this. Say for example, a patient is having a fever, okay, and a fever is such kind that when the fever is rising, when the temperature is rising, the patient is feeling that, I'm so weak, and I need rest, and I'm sleeping, or I'm feeling chilly. So these sometimes, you can get these kind of fever condition where you really feel weak and you want to lie down. So it is not that this is something which is very aha type, how Shekhar sir says, which is very characteristic type. But if a person is telling that, doctor, my child who is having 1 or 2 degree temperature, and can you imagine, he is just jumping in and around, he is jumping and playing all the time with this fever, and otherwise he is okay, I mean, like, he is okay like how other kids play. But especially in this fever, I'm observing that his activity has increased drastically, which is something which is very peculiar, because generally in fever condition you feel drowsy, you feel lethargic, which is common. If patient is telling that, and if you are taking those kind of symptoms, then you would lead to common things. What you have to see is which is very characteristic and which is very peculiar, which is not suitable for that particular malady. Okay, and the second important thing is, while handling acutes, we generally use those study materials, those books which are clinically proven. These are the books in which the remedies which are given under the rubrics are, or under the materia medica, are clinically proven things. I mean, each and every remedy have been added in that book after being seen in their clinic. So that becomes, a kind of surety that this is, this remedy has helped in such condition. So generally in the acute cases, we do not go with the bigger or the newer books, where many remedies are there, but not necessarily that they are clinically proven. Borix repertory, Borix materia medica, Allen's keynote, Fartex materia medica, and Fartex repertory. These are the commonest thing that we use. Then third important thing that we strictly follow in acutes is we do frequent follow-ups. If the patient is pediatric patient, then after every 2 hours we give a call or we give a message to the parents, inquiring about child's health. In adults case, like it depends upon the cases, like how severe the case is. So we do a timely follow-up, and which include night time also. So if the case is severe, we will not hesitate to tell the patient to contact us anytime, like 24/7. And that also brings in a good doctor-patient rapport. I'm coming to that point in the next section. So the fourth important thing is that we also follow in the acutes is we take the help of investigation, the reports wherever they are needed. So we do not keep ourselves like, we have given the remedy and this is the actual remedy and there is no need of reports and all. We do not do like that. If indicated, their patient coming with the stomach ache, though the indications are indicated towards a specific remedy and you are very much sure about the remedy, but it is always better to investigate and find out what is the reason of that stomach ache, whether it is a gallstone colic, whether it's a kidney stone colic, or whether it is a pancreatic colic, or what it is. So it is always better to investigate, because that gives us the clear cut indication to prognosis of the case. Because sometimes after handling the acute, we may require to tell the patient to, this is the condition, I have handled the acute, but it is better that you please look into this matter and give your detailed case history, so that we can handle this complaint for a long lasting duration, so that you would not end up into these kind of acutes in future. And now let's come down to the third part, that is what acutes give to us. When you are successfully handling the acute condition, or whether you take up the acute condition and put your 100% effort, what happens after that? The first and the foremost important thing is you have developed a very good doctor-patient relationship. That rapport which you have created in this short duration of time will help you immensely in the future, because that gives a kind of confidence in your patient to that this is a person me in my critical situation. I trust him, I trust her 100%, and in future if anything is happening to me, I'm coming down to this person only, I'm coming down to this doctor only. So that gives a lifelong relationship, not only for this patient, along with this person their relatives also become your patient. So this is very important, because when you handle these kind of critical situations by putting your 100% effort, that gives you immense confidence, that makes your principle grounded. The principles on which we practice, it becomes very solid, that yes, it works. Now let's come down to that special tip for which you have heard me, you have tolerated me till the end. There are some cases, even though you put your 100% effort while interrogation, you will not get clear indications from them, that is on which you can prescribe a homeopathic simillimum. They will give you only disease specific symptoms, and that's the end of the story. So when these patients come to you for the acutes, that is the time their vital force is at the peak, it is superficial, and that is the time the vital force gives you actually the clues to solve those cases. When they are suffering from the acute, because that is the time they cannot hide, or they cannot compensate that thing because it is not over a period of that time that they are compensating it. It is just happening today. They will be telling you clear indications while telling you their acute symptoms. So these acute symptoms will give you some clues to solve their chronic maladies. Believe you me, you please go back and see and let me know when you find such kind of experiences in your practice. I would request you to, when you go back and when you apply these things in your practice, please write to us in the comment section, give your feedbacks, how these points are helping you.